All right, so I think we've just shared with you sort of the whole spectrum of all of the areas that we touch and that we focus on, from very specific things to global things to fiduciary responsibilities. And so we just wanted to give you a sense of all the various pieces that your CCO is involved in and that we take seriously. And so I hope that gave you a bit of a perspective there. So I have a bunch of questions here I'll start to answer. I wanted to see if there was anybody in the audience who had any additional questions, or if you want me to just start with these. And I'll probably reach out to some people in the audience to help me answer some of these questions, because some of them I cannot answer all of them. And if we can't answer them, we will certainly work on getting an answer. And if you put your name on here, we'll be able to follow up with you. So I just want to give a chance. Was there anybody in the audience who had a burning question to ask right now, or I'll start with the questions? Not to put anybody on the spot. Okay. So right in line with one of our discussions we just had, Chandler asked a question around alcohol and drug and what's happening from addressing that issue, whether it's in Lincoln County or Linn or Benton County. And I will say that certainly that is an area that came out loud and clear in the Community Health Improvement Plan as a need in the community. It's something that we hear feedback within various elements of community feedback that we get around the need for additional services related to alcohol and drug detox. And I can say that I know that Samaritan Health Services on the provider side has a task force that's looking at what services are currently available in each county, what is needed in terms of a program and how it would look, and what resources are available now or what resources could be looked at in the future. And so that is something that is being evaluated, especially as we move into the new year. And so Chandler, that's a little bit of an update. It's not a final answer, but it's certainly recognized that it's an opportunity that everybody's involved in. And I know Samaritan Health Services is also working with other partners to figure out what's available and what the options are. So I would expect to see more coming in the new year around some opportunities and some options.
So are you talking about a regional IHN task force?
So it's not
here as well.
Okay, it's not IHN specific, because we're being really cautious, right? Because it's broader than that, but it's Samaritan Health Services on the provider side is really taking the lead as it looks at the service area it serves, which is the same service area as we serve. So it's all three counties and what is available and how can we do something. So they're taking it very seriously, and I'm on that task force, so certainly bringing that IHN perspective, and so we'll definitely share when we get to a place where there's some concrete information to share, but it is being looked at very closely. Okay, as I keep bumping into that. There's one around transparency and the fact that the board meetings are not a public meeting. So the legislation did not mandate that the CCO board meetings statewide are a public meeting. We have had this discussion. We've had this discussion in the board meeting. We've had this discussion at many of these public meetings around that. The IHN-CCO board meetings are not a public meeting, but we do work very hard to make sure that people have input at the Community Advisory Committee, which meets every other month, or at the local Community Advisory Committees, which meet much more often than that. At these types of meetings, at the CAC meetings, we do give a utilization graph update every time in terms of where the dollars are being spent and how they're being spent. I don't have that with me, but so we do try to get that information out there and make sure that it's available and get the feedback from the community. But that is a decision that was made in terms of how we would make sure we got that feedback, and it wasn't that the board meetings were public. Okay. Track phones. Can IHN-CCO start providing track phones for OHP clients? So this is a great one. Where's Christy? So Christy works with us in our communications, and we've really looked at this and are evaluating all the options around outreach and being able to reach our members, and as Kim often says, lay the sidewalks where they walk. So how do we know where they are and how can we find them? And so I don't have an answer for that, but that is something that we are always looking at and determining does it make sense, and how would we make it work, and how would you get it out there, and what would the use be? And I know there's some national programs around how successful that is. We have not moved in that direction yet, but I'll make sure we take that back for a discussion. Did that answer your question, Gary? Okay. Another question was around utilizing self-help evidence-based services such as the Stanford Living Well with Chronic Conditions. And I know that we have supported this in the past. I'm looking at Dr. Yuan Chinna, and I know we are supportive of it in the past, supportive of it now as well. So I would say that absolutely, and that's something that we're supportive of and would encourage, if that meets a need for a member, would encourage them to be part of that, if you're familiar with that program. This is a great one. It says, what kinds of idea sharing exists between the 13 CCOs in the state? And there's actually 16 CCOs in the state, and there's a number of ways that the sharing happens. So Rebecca Fowler, who Dr. Eby introduced as our Community Advisory Council coordinator. There's all of the coordinators from all of the community advisory councils for all 16 CCOs have a regular meeting that they talk about how things are going, what they've learned, what are things that work, what are things that didn't work, how do we do outreach. So they do a lot of sharing of best practices there. The 16 CCOs meet with the state regularly on a number of different topics, whether it be around quality, around data, around pharmacy, the CEOs. We all meet once a month with the state as well. So there's a lot of information sharing. I think the interesting thing about this question is that each of the CCOs, one of the value statements of the CCO legislation was that all healthcare is local, and so they didn't give a roadmap of what it should look like. And Commissioner Hall has often talked about this at the board meetings, where we don't really have we were given an outcome to reach towards, but no specific way on how to get there. And that was actually on purpose, because each community is different and the state wanted to make sure we had the opportunity to do that. So we do share a lot, and then we also learn from each other, but we also make sure we keep it local. So this is a question about how things are going at Lincoln County Mental Health, and I might have to defer to Cheryl just on how things are going at Lincoln County Mental Health. Could you give Cheryl Connell a microphone, please?
Can you hear me?
Nope.
Hello?
Okay, you might have to come up with me.
I have a pretty loud voice.
Okay. Or you can come up here, whatever you prefer.
So what is...
It's just how are things going at Lincoln County Mental Health?
Okay, that's kind of a pretty broad topic. So I can tell you, Lincoln County Mental Health is working really hard to ensure that we have the services that our members need in order to get healthy, stay independent. We recently moved our adult behavioral health services from our South Beach Clinic site into our site located in Newport on Lee Street. We have a really warm, inviting kind of atmosphere there, and we're really excited about our ability to not only be closer in town where our clients and families can more readily and easily access services, because we didn't want barriers of transportation for people to be able to come to get services. But we also have now the ability in our new facility to do a wider variety of services, including more groups. We had constraints at the other site that really prohibited us from being able to do what we wanted to do. So we're very excited and are very optimistic about our ability to meet the need for our Oregon communities. So we're on a hiring spree. We're getting new clinicians in. We have some very, very interesting and motivated clinicians that are coming on board. So again, as we bring more and more individuals who can actually see clients in, we're really excited about the good work that's going to be happening. The other thing that we're looking and doing more of is doing more communication and integration of our behavioral health services and our primary care services. We're putting a lot of effort to be able to have a more holistic approach. And that isn't limited just to the individuals that we're serving in Lincoln County behavioral health and primary care. We're looking to do more branching out into the other primary care providers in the community as well. So I'm really looking forward to the coming year for our Lincoln County Behavioral Health Services, and I'm really glad that somebody asked the question so I could come up here and say that.
Great, thank you. And so the final question I have is around dental services, and Lincoln County has a dental crisis, 6 months waiting to see a dentist for the first time in Newport, and 3 months to get treatment. Is Samaritan getting more dental providers? So first of all, I guess I would clarify that Samaritan Health Services, the provider side, doesn't employ or manage any dentists. IHN-CCO, we contract with 4 dental plans to provide dental services. That's actually part of the state rules in terms of how dental is delivered. So this is great feedback for us. We just had all 4 of those dental plans come to our regional planning committee last week and share some of the projects and what they're working on. And I would say that the integration of dental is probably at least a year, in my mind, a year behind the integration with behavioral health and mental health. So it's coming. It hasn't come as quickly, but I think, we know access is an issue, and we'll continue to work with our dental providers to work on making sure that access is available. But the feedback is always appreciated, and we'll make sure we share that with those groups. So unfortunately, I can't answer specifically about adding new clinics, but I do know that they know that it's an issue, and I'll make sure we take it back to them as well. So that was my list of questions. Are there other questions? Are there any other comments anybody would like to share, or perspectives on how things are going? Yeah, Chandler.
I had a second question on my card.
Did I miss it?
Press release about a series of meetings on transportation and health services. Huge issue, of course, in Lincoln County. The greatest distance, the greatest internal and external transportation issues. However, both of the meetings were in Corvallis, and none were in Lincoln County. In fact, Lincoln County wasn't even mentioned. Why is that?
I will defer to Kim because I do not know that answer.
Those meetings aren't sponsored by the CCO. So those meetings are sponsored by the Council of Governments, and we can find out why Lincoln County wasn't included. Well, not like you, because Lincoln County apparently wasn't included, but we were interviewed as part of their analysis of the issues. So, and then there's some meetings next week, December 8th and 9th. There's follow-up meetings that we've been invited to where we plan to go and learn more. We will certainly, as we do in all things, advocate for a tri-county approach. So we will definitely bring up, if Lincoln County wasn't included, we will bring it up that we would appreciate that they are included. So good point, thank you.
Sorry about that. I didn't mean to miss your other question, Chandler. Oh, there's another one.
Just a quick comment. OHP clients do have the right to transportation for appointments inside the county, outside the county.
Yeah, yes, there's what's called a non-emergent medical transportation benefit, and it's run by the Council of Governments, but it's available to all OHP members to get to appointments. That is true.
Actually, for those that are interested, we have a flyer back here in the back, and there's a magnet, has information, has the phone number.
For transportation, so if you can't hear, there's a flyer in the back with a magnet if you're interested in finding out more about transportation.
I was just going to say a little bit more. I wanted to maybe clarify or speak to Chandler's point on transportation. The IHN-CCO covers transportation for medical, mental health, dental, health-related appointments. Currently, we are not provided dollars to cover transportation for social determinants of health that might result in a healthcare outcome of our members. So, for instance, if you live in a food desert and you can't get to quality, nutritious food, our current benefit doesn't cover the cost of helping you get there. And that's part of what I think the COG is looking at, is how does the intersection of transportation and health how is the structural development of transportation within a community have an effect on the health of that community? And it's looking at that intersection and from a social determinants broader than just the physical health, mental health, dental health perspective.
I think that is exciting news. If you're looking at that broader, scope of the issue. But it seems like at this time in this county, there's still an issue with even having enough drivers to help people get to just the medical appointments. I know a lot of the clients that I work with are running into issues of not being able to make those appointments, having drivers not able to show up at the appointment time because they're so backed up themselves.
So we'll take that back as well. Thank you.
I do have another one, quick one, since I've got this mic.
Go for it.
So I'm wondering about where on the radar with the CCO is the concept of trauma-informed care. Is that something that is on the radar and promoted for the various providers?
So it is on the radar and discussed, and I will defer to Dr. Iwancina to answer that.
So thank you for bringing that up, because it's actually an extremely important part of the healthcare delivery system. And we've actually put on some educationals as part of a grant process for trauma-informed care, for trying to train more people to be aware of how trauma affects people's lives and not re-traumatize them while they're going through different social service agencies, through the healthcare system. And it was very enlightening for me to hear from our medical students at the Lebanon school, where they came up to the IHN-CCO and said, we really are doing a lot with teaching our medical students at the very beginning about trauma-informed care and ACEs, adverse childhood experiences. And so that was heartwarming to me, because from a medical perspective, I didn't know this when I was going through my medical school training. And having young doctors that are learning this at the very beginning of their medical careers will only help the healthcare system and avoid any re-traumatization of people that have had trauma. For those that aren't aware of adverse childhood experiences, there was a scale that was done many, many years ago by Kaiser. And what Kaiser did is they looked at their entire workforce and had them evaluate their different chronic diseases. And in this closed evaluation was also the eminence of a lot of trauma that people had had in their childhood. And they really weren't putting together this cause and effect of cause of trauma in childhood and how it can make your chronic diseases actually worse in later years. There's now some emerging science that states that if a pregnant woman has a lot of trauma while she's pregnant with that baby, that they've been watching these kids growing up, and their risk of having more chronic diseases is actually higher than women that will not have trauma or not have trauma while they're in a pregnant state. So it's a really, really important part of everybody that interacts in the healthcare system to really, truly be aware of. So I'm so glad you brought it up, because the more that we talk about it, the more we decrease any stigmatization of trauma, and it makes us open to hearing what our patient stories are.
Are there any other questions? Feedback? Okay, well, thank you very much for coming. We really appreciate it. We hope you got some food. If you want to take a sandwich to go. And again, thank you. Oh, Gary.
Could we just have a show of hands of how many attendees at this meeting are actually OHP members? Current OHP members.
Current, is anybody here a current OHP member? Thank you. Oh, thank you. Thank you. Oh, thank you. Thank you. Thank you for sharing that.
We're doing some
filming in the back.
Oh, sorry, I'm like, what? Okay, so we're trying to make sure we get all the feedback we can, and if you're interested in being on film, and you do know we post these videos of these meetings on our website, so that if people aren't able to make them, they can see them, and then we do one of these in each county every year, so that if you want to see what happened in Benton County or Linn County, you can go on there and watch that. But we're trying to get feedback from people who've come to the meeting on what's working within the OHP, or how the meeting is working, or just any feedback you'd like to give, and you would be willing to put that on camera. Go right outside the door here, and we would be happy to have you as part of our video presence. So thank you. Oh, yes.
Just wanted to be part of the OHP plan. I wanted to thank everybody who's working really hard and make my kids grow healthy and be part of the community. And thank you everybody for doing such a great job. Your information is amazing, and it makes me think, it makes me more calm that you guys are working to get better.
Thank you for sharing that. That's why we're here.